starting from the heart. So this way you're able to follow a bunch of the blood vessels a lot more easily, okay? So always start from, I always like to start from the left side. So this way, you know, we are tracing the oxygenated blood and then going to, you know, the systemic circuit, and you're looking at, and then come back and do the veins, okay? So let's start from the left-hand side. So your left-hand side is going to have oxygenated blood that's coming in through your left, okay? So it's pretty much your left vein, okay? So your left pulmonary vein, it's going to come in through the left atrium, and then it's going to go, blood is going to go in through your bicuspid or your mitral valve, and then to your left ventricle, okay? So then your left ventricles are going to contract, they're going to move blood through your aortic semilunar valve to your aorta. So right now I'm in the aorta, and this is what we call the ascending aorta, okay? So that's where the difference comes in. So ascending aorta, then you're going to go to your brachiocephalic trunk. So at this point and right here, just at this point, this is the brachiocephalic trunk, and part of the aortic arch then is going to be the left common carotid, and then you're going to have the left subclavian, okay? So let's follow the brachiocephalic trunk first. So brachiocephalic trunk then becomes the right common carotid right there, okay? So right common carotid is then going to branch off, okay? So it's going to branch off to my right subclavian right there. So that's my right subclavian. Then I'm going to go through the axillary, okay? So that's my axillary artery, and then my circumflex right there. So that's my branch, okay? So axillary artery is then going to become two arteries, okay? The first one is going to be this is going to be the brachial artery, okay? So then brachial then becomes the radial artery right there, because there's my radius, and then I'm going to end up with an ulnar artery right there, okay? So ulnar artery, radial artery from the brachial that came from the axillary, okay? So ulnar and radius, ulnar radius are going to go ahead and they're going to branch off, so I end up with the superficial palmar arch right there. So it forms an arch, and then I end up with my digital arteries, because these are my digits, okay? So let's go back up. Now, let's go to the left common carotid, okay? So left common carotid is going to go up. So I end up going to my facial artery right there, okay? And if I go up that way, this is going to be my temporal artery, okay? So your facial and your temporal artery, since they're on the external, they actually come from the external common carotid. Now my internal is not here because, I don't know, for some reason they didn't put it there. So the internal would have been right here, because the internal common carotid would then go and feed oxygenated blood to your brain. So it would be right there, okay? So right here, this would be the left common carotid that then branches off to my external carotid, common carotid right here, and then one of the externals would feed to your facial artery and then your temporal artery. So then my internal common carotid would have been right here, and then would feed to my brain internally, okay? Okay, now aortic arch again. Now this is my left subclavian. So left subclavian is going to go that way and then branch off again, just like your right. Then I would have axillary and circumflex, okay, and go all the way down again, okay? So that's your arteries, okay? So let's talk about the veins, okay? Now the veins are supposed to come